It's time to get sexy on Secular Sexuality.
Hello, and welcome to Secular Sexuality, the ACA show that's bringing you placenta, frankincense, and myrrh this holiday season. With me, of course, is Bianca.
Hello, everybody.
And joining us tonight for the very first time is Britney Farmer. Howdy.
Hello.
Britney is contracted through a hospital-based doula program as a birth doula. What does that actually mean? Can you tell us what a doula does? Because I've already gotten that question 3 times this morning.
Okay, yeah. So, so I'm in Seattle, and really a lot of this is coming out of Seattle. But even up here, a lot of people do not know what a birth doula is. There are different kinds of doulas. I can obviously speak most to what a birth doula does. You can kind of categorize it into 3 different kinds of support, which would be emotional support, physical support, and informational support. So when people are giving birth, whether that's in a hospital or at home or a birth center, there's probably a lot that they don't know going into it because we don't learn these things growing up in school. We just learn that birth is scary and it hurts. Mm-hmm. And so I do a lot of like some basic childbirth education was part of my doula training. And I also, during labor and birth, I'm basically doing anything to make them more physically comfortable. That can be like hip squeezes and counter pressure. It can be like really strenuous for me, or it could just be like putting a cold washcloth on their face or something like that. Anything to make them more physically comfortable. Mm-hmm. Also making sure that people are understanding the information that's being communicated to them by the medical team, and that they're able to make informed decisions along the way.
So you're present during the birth itself and actually, offering mm-hmm. that kind of support. You're not a nurse or an obstetrician. I mean, what is your training and your direction, I guess, look like?
Mm-hmm. I don't perform any clinical tasks. I don't touch anyone's vagina. I don't assess for like blood pressure or anything like that. Sure. I am just being their emotional support person. That's really the primary role, is the emotional support. So a lot of times, like if we're in a hospital setting, which I have been for every birth that I've attended, nurses are in and out. They're looking at monitors and they're looking at baby vital signs and parent vital signs. And that's primarily what they're concerned about. They can be very encouraging too, and they do really amazing work. But they're just not in the room the whole time. And they have this other role that takes up a lot of their time and attention. And so I can be 100% dedicated to the emotional support.
How is this different from a birth coach or a midwife? Or, I mean, honestly, I'm not even sure what all of these terms mean and which ones overlap. Mm-hmm.
So midwives are medical professionals. But their practice is completely about birth. They don't do other types of medical practices. Mm-hmm. There's different kinds of midwives. Some have hospital privileges and some don't. Some are legal and some aren't. I can go into all that if you want me to, but they are like, if my client's blood pressure gets too high, that's what a midwife or a doctor or a nurse would do something about. That's not anything that I would do something about, but sure. I might notice signs of it, and I might go and get the nurse if the nurse isn't already in the room.
Yeah, working as like an educated advocate for the patient as they're going through this mm-hmm. process.
Interesting.
Yeah, it's like, just because I've been in the room as many times as I have, I have an idea of like what looks normal and what doesn't. And so mm-hmm. that's really what a lot of people are hiring when they hire a doula, is someone that can say, no, this looks normal. Like, yes, I know it feels like you're dying right now, but this is normal. And just things like that, just having that perspective in the room. And that continuous support as well, because once I'm called in, I have an hour and a half to join someone in labor. And typically these labors go on for, 12, 24, and 36 hours. So mm-hmm. that hour and a half is, just time for me to get ready. And then I'm there until at least a couple hours after the baby is born, depending on what goes on. Sometimes I've been with a family for 6 hours after baby is born.
Yeah, it felt kind of like we were playing roulette by picking this date to shoot this episode, since you are kind of always on call and have that
Mhm.
risk of being whisked away, I suppose, to a birth.
Yeah. Yeah.
Interesting. So they
Yeah.
allow doulas to be in the room in hospitals along the whole pregnant birthing experience.
Yeah. And so that's I'm contracted through a hospital in Seattle, and so almost all of my births have been at the same hospital where they have a doula program worked
Okay.
into it. This is a pretty unique program. There might be one or two other in the country, but this is definitely not a regular thing. So I can't speak to what the protocols would be in other hospitals. I know in this one, you're allowed to have up to 3 support people with you at all time. That would include like a primary partner. So and then 2 other people. And the doula does not count as one of those 3 people.
Okay.
In other hospitals, it might be different, that like your doula is one of your support people and you only have, 1 or 2 other that you can have in the room with you. I can also usually be in the operating room for a C-section too.
Okay.
Yeah, we've kind of danced around it a little bit, but can you clear up any misconceptions about a hospital birth versus a home birth, and maybe where some of that tension is?
Yeah, just like the fact that doulas attend both and can be in both roles, or what?
Yeah, that, and I guess
Mhm.
just the validity of home births.
Mhm.
If that's not an unfair
Mhm.
question, I feel like that's definitely the conception for a lot of folks, that they are
Mhm.
unsafe, that they're unhygienic, that
Mhm.
they are based on sort of this woo-woo philosophy and maybe not
Mhm.
appropriate in a modern world. But I've
Mhm.
also seen a lot of research that would push back against that, and so I'm very
Mhm.
curious why you're working in a hospital-based program, how common that is, and
Mhm. Mhm.
whether there really is value in either modality.
Yeah, sure. So I mean, it's all about personal preference. The studies do show that someone with a low risk pregnancy is not any less safe giving birth at home than they are giving birth in the hospital. The US is literally worst amongst developed countries in terms of maternal and fetal outcomes. So if you're having a baby in the United States and you give birth at home, that's not statistically any less safe than giving birth in a hospital.
Mm-hmm.
Um, Things come up last minute. Things can happen unexpectedly. I've seen it happen. So for that reason, I think a lot of people try to go for like an unmedicated birth in a hospital setting, for example. Like a lot of people are kind of trying to find the best of both worlds. But then some people just want to stay out of the hospital altogether. Some people would never even, they want to be in the hospital as soon as they are like meet criteria for admission, because like at the hospital that I work at, they don't want you to be admitted in early labor because early labor is very unpredictable and can take a long time. And um, the chances of you having unnecessary interventions are higher if you are admitted to a hospital like earlier on in labor, because then they might just want it to get on a more regular pattern and try to use medications to make that happen.
Mm-hmm.
But that's just not the nature of early labor. So now, like what's common up here is a lot of people are doing early labor at home, and then they're being admitted to the hospital when they're in active labor, when things have really picked up and contractions are like 4 to 5 minutes apart or less. So they're doing a lot of work. And some people don't want to be at home when they are feeling all these sensations that they've never felt before if it's the first time. So
Yeah.
I
So
think
are
there's
you?
definitely, I'm glad that there's options, for people.
Sure.
So I know that you're working through this specific hospital. If they have early contractions and they stay home for that, are you there for that as well? And then you accompany them to the hospital, or do they meet you there? How does that work?
Mhm. Yeah, I can join people in labor at home. I haven't actually been asked to, just because usually around the time that someone wants the doula to join them is also around the time that they want to be heading to the hospital.
Mm-hmm.
But yes, doulas join people and help them labor at home and can go with them to the hospital or meet them there. Just depends on what's going on.
Interesting.
Yeah, so you're available for labor and pre-labor. What are the other
Mhm.
components of it? I mean, I know there's a lot of, I guess, sort of coaching beforehand. And are you
Mhm.
monitoring nutrition, or offering
Mhm.
exercises, or what does that look like?
hmm I do at least 2 prenatal visits when I can. Sometimes people hire me when they're like already full term and or their due date might be a week away or something, and we may
Mhm.
not be able to meet as many times in that case. But when I can, I do 2 prenatal visits, and we just talk about what they're looking for. I ask people questions like, "How do you want to remember this? You're going to remember this the rest of your life. What do you want that memory to feel like for you? What do you want that to look like? And
Mm.
what can I do to make that happen?" Because I don't have any control over what happens, and I make sure that my clients know that, but I can help it be more manageable or more comfortable for them is
Mhm.
the ideal situation.
Mhm.
So we talk about things like that in prenatal visits, and then we have 1 or 2 visits, and then I'm just waiting for a phone call that's like, "Hey, I think my water broke," or "Hey, I've been having contractions for 6 hours," and, like whatever the case may be. And that phone call can come at literally any time of the day. And then I have that hour and a half to join them. And then they have the baby. And I stick around in that immediate postpartum period. I'm helping, if they're breastfeeding, I'm helping with that first latch and helping baby get kind of oriented, and also just kind of protecting that time because those first couple hours of bonding time are really important. So a lot of times people are asking me like, should my family come now? And I'm like, maybe not. And just kind of helping them like make those decisions. And so then I talk to them the next day. I check in the next day, make sure everything is going okay and that they're getting the care that they need. And then I see them 3 to 5 or to 7 days after the birth, and then usually a second time within a month, and just stay in touch over that time. I am paying attention I'm asking them questions about their mood and trying to look for signs of like a postpartum mood disorder.
Mhm.
Mhm.
That's actually it's actually the most common complication of pregnancy is a mood disorder. So we hear about all the medical complications, but we don't hear about the mood disorders as much.
Mhm.
So I'm paying attention to things like that and just making sure that uh, everyone's basic needs are being met. I'm not a postpartum doula, so I'm not like spending the night in the house. I'm not super hands on with baby care or anything like that after the birth. I'm just making sure that everyone is sleeping and eating and adjusting.
Mhm.
Yeah, so those types of doula services do exist, though. Then more so than just the week beforehand, and more
Oh,
so
yeah.
than the occasional checkup. People are occasionally asking for somebody to spend that first night in the house and be around for those
hmm
kinds of things. How is
Yeah.
that helpful having that, I guess, extra pair of hands, that
hmm
experienced person in that whole equation?
Yeah, definitely extra pair of hands goes a long way.
Mm.
Um, and you're just thrown into this completely unpredictable routine that is dictated by this newborn baby that doesn't speak your language yet
Mhm,
and communicates by fussing and crying and like moving their mouth and moving their face. So it's like I often will tell my clients, like, your baby is not the only newborn in this room. Like, you are also a
mhm,
newborn. Everybody is a newborn. I'm visiting 3 or 4 newborns today. And um, so I think a lot of it is just reassurance that um, it is hard. There's an expectation that you have a baby and then you just know what to do because it's just natural, right?
mm,
And that's no, like babies don't come with manuals and every baby is different. And it's hard to know what needs are normal and what needs are not normal if you've never done it before. So a postpartum doula would do a lot of the same things that I do in the labor room. They just do them in the home. They just reassure them that this is normal or this isn't. And they make that experience more comfortable and more manageable.
Yeah, so you're around before and during and after the birth. I mean, you're
hmm
on call and constantly waiting for that like hour and a half window. What does a
hmm
typical work week even look like for you?
hmm Sometimes, so right now I also have a second job in the same doula program that I'm a doula in, and it's an
Mhm.
administrative job. So right now I'm also spending like 25 to 30 weeks or 30 hours in an office, connecting people to doulas that are
Okay.
calling the program to find a doula. And so when I first moved to Seattle, I was only doing the doula work full time. And that could mean I could go like a week and a half, 2 weeks without really doing anything and just doing whatever I felt like doing that day. And then I'd get that call to go and join someone in labor, and then would start the follow-ups and everything that comes after a birth. Now it's a little bit more crazy. And like last week, I was in the office Monday, out of birth for 14 hours Tuesday, in the office Wednesday, out of birth for 14 hours on Thursday, in the office on Friday. I saw 2 different clients on Saturday that were like all over the city. And then on Sunday, I spoke on a panel as a doula talking to birth doulas in training. So my Monday to Sunday were just jam-packed with doula things.
Yeah, sounds
and I
like
didn't
it.
really get a lot of recovery time from the births. And those births followed these very similar timelines. Like in both cases, like Tuesday morning, I get a call around 5:30, and that baby was born around 6:30 p.m. the following day. So I was there till like 8:30 p.m. or so that night. And then Thursday was almost the exact same thing. I got a call around 5 or 5:30 in the morning, and that baby was born around 7 p.m. And I stuck around till about 9.
Okay.
Yeah,
Wow.
that sounds like a pretty wild
I
schedule.
thought my week was
Yeah.
hectic. Wow.
Well, let me ask you this then. Why do it? I mean, why is this important in terms of healthy babies and safe parents? And, why is this extra service something that people are willing to spend money for and go out of their way for?
Yeah. I mean, so it is shown that people do tend to have less unnecessary interventions if they have a doula. And that's partly because they've had some education around that. And they've also just got someone in the room who knows, has an idea of, what can be necessary and what can be not necessary. And we can encourage people to like engage in these conversations and really kind of get down to the bottom of that. So that is safer, when you're not having interventions that you don't need, tends to lead to a better outcome.
Yeah, it's like having a patient advocate with you throughout the whole process.
Yeah.
Right. Yeah. But then also kind of my like idealistic view about this work is that if people have better experiences, more positive experiences in labor and birth, then they are able to bond more with their babies. And then that baby could grow up in a more positive environment because of it. And like it could actually make the world a better place by like making individual people better people because their birth is less traumatic for the person birthing them,
Yeah. We hear stories about medicated parents being sort of pressured into making decisions about circumcision, for instance, or, even more extreme stories about intersexed individuals being, their parents being pressured to do invasive and unnecessary surgeries. What is your role in all of that? I mean, certainly it is the patient's choice, but how are you able to, I guess, step in and protect these babies and these families in those moments?
Yeah. A lot of it is normalizing things or like undoing myths. And so if I was supporting a family who was trying to make a decision about circumcision or trying to make a decision about some, surgery on their baby's genitalia, it's personal. I don't make that decision for anybody, but I can certainly ask them, is this something that you would only want to happen if it's medically necessary? Or would you want it to happen even if it's not medically necessary, and just kind of help them get to the bottom of that. And I mean, some people are going to want the surgery, and my job isn't to have any opinion about it, honestly. And then some people aren't, and they'll just appreciate the dialogue around helping them feel good about that decision because there is a lot of pressure around those things.
Yeah. What are some of your concerns or maybe some of your own beliefs in terms of birth advocacy and, creating the best possible outcome in extreme situations like that?
Yeah. I mean, I think that, again, I come back to that question of like, how are you going to remember this? And as a doula, my role is to make sure that people feel supported 100% of the time and that they never feel abandoned. And so typically like things unexpectedly happen, that it's very rare that there's a case where labor starts and nothing surprises you after that happens. So I don't know, I mean, I just try to, it's like, because we did crisis work together, right? And so at this point, I've just made a living out of helping people feel better in high intensity situations. And
Sure.
I'm, I'm learning like it involves a lot of taking my own feelings out of it. So it's like almost hard to answer a question about like, well, how do you feel about it? Because I've compartmentalized that so much.
Hmm.
If it were me going through these things, I don't know what I would do. Like, I know that I would want a doula there.
Mm-hmm.
And,
Good to hear.
you know.
Yeah.
Yeah, I don't mean to be so black and white about it, but in my mind, it's almost like there are only two types of birth experiences. And one is like out of a 1950s, like black and white, voiceover sex ed video, where, the doctor comes in and is like slapping the baby and is like, it's a bouncing baby boy ready to fight the communists. And then the other is like in a bathtub in like or a kiddie pool in like a barn somewhere. And there's like sage burning and all of these kinds of things. And I recognize that those are both kind of extremes and a little bit ridiculous, but I am kind of curious what sort of misconceptions you see about whether it's hospital births and like the convention of it all versus sort of maybe the new agey, more, I don't know, more progressive ideas.
Well, a lot of people think that labor doesn't take a very long time. And or they just
every TV show you ever see, it's like water breaks, 15 minutes later, there's a baby.
Yes, exactly. Yeah, babe in arms. Yeah.
Yeah.
With everyone in the room, like touching the baby.
Yeah, shouting, push.
No, I mean, okay. So the two scenarios that you described, those are not the only ways that birth happens. And my goal is that people they feel safe enough to really get in touch with their bodies and allow themselves to find their own natural rhythm, because coping with labor and not feeling defeated by it involves having a rhythm and having a ritual. So, but that rhythm and that ritual is unique to every person, and it just kind of will happen organically if they have the space and like the safety to do that. So I'm like, no matter what's going on, I'm trying to create a space that allows for that to happen. So if someone's like, I want to labor in the tub, or I want to labor in bed the whole time, like, I don't care. I just want them to feel like when like their body wants to start making noise, or their body wants to like get rid of some fluids, or their body wants to get rid of some poop, or like whatever it wants to do, I want them to be able to let that happen and not feel like they need to apologize for it. There's so much apologizing that happens in labor. And I try, I don't want people to feel like they need to apologize for anything that's happening. So on one hand, it's the most normal thing that we do, and it works, or we wouldn't be here, And
giving birth, you mean?
Yeah. Childbirth. Yeah. It's the most normal thing. It's the reason that anything exists that we're consciously aware of, like in this lifetime, is because people have been giving birth. And then it became a much more medicalized thing. Like, as an example, in early labor you have, or in like pre-labor, you have these practice contractions that aren't really changing your body. Like the contractions you have in labor are like what make your cervix dilate. And before that, you have these like warm-up contractions that don't really change your body. It's just the uterus practicing. And they're called Braxton Hicks contractions because some man at some point, like women have been having these contractions forever. Some man discovered it and said, I'm going to call these Braxton Hicks contractions. And so there's a lot of that in the field. And I just try to like normalize it and be like, no, this has been going on forever. This has been going on since before Braxton Hicks was alive. And this is something that we don't need those labels and like those things to be able to do. Sure. But that's not to say that everything is straightforward. Like a lot of times there are curveballs and things. And I've been really really blessed in the sense that I have seen nature's design come together and work harmoniously with modern medicine. So I don't think that there's like no place for modern medicine in birth. I think that it saves lives. And I'm thankful for everyone that is trained in cesarean sections because they're much safer now than they used to be. And that's great. But I also don't want them happening unnecessarily. You know, I don't want my families and my clients recovering from a major surgery that they didn't need.
Right, that makes sense. I feel like you probably, I don't know if this is your experience, but when I hear doula, I have a very specific image in my head. And I would imagine that the people who are looking for a doula then are like, wait, you're going to make me give birth in a hospital? What is that? And then the people who are in the hospital will be like, well, why do I need a doula? I'm in the hospital. So how do you, this might be more of a marketing question, but like, how do you reach the people that you need to reach and make yourself available for whatever it is that they need?
Yeah. I mean, so in my case, being contracted through this program, the referrals are steady through the program. I'm also in the fortunate position of doing the matching of doulas and clients. So if someone with a due date that works for my schedule comes through, then I can recommend myself.
First dibs, nice.
Yeah. So, which doesn't mean that they hire me or that they even want to meet me, but I can at least, you know, throw my name in there with amongst other names of doulas. So that's nice. I am in a very unique position as a doula where I'm not really worried about referrals. I will say though that I'm not always working with like my target client, you know, because I do want to do more births outside of the hospital setting. And I have ideas about like, I want to be this like sex positive doula that talks to clients about like how to have comfortable sex while pregnant and like when ways to be intimate post birth and things like that. So that's kind of the direction that I see myself going in. And where I'm at right now, I just kind of work with, you know, whoever kind of fits with my schedule and doesn't live too far away and those sorts of things.
Okay.
Yeah.
Yeah.
Does that answer your question? Okay.
Yes.
Well, and to V's point, I imagine you're working with a lot of parents that are, you know, skeptical about giving their children necessary vaccines and things like that. But you're also, you know, trying to navigate avoiding that over medicalization and avoiding unnecessary surgeries and things. So I'm really curious what sorts of things you've seen and how you've had trouble maybe navigating those things.
Yeah. Honestly, pretty much everyone I've worked with has wanted, there's 3 kind of like routine baby care medicines. One is a vaccine that they will routinely give in the hospital. So like my role, one of the first things I do in a prenatal visit is be like, these are all the things that they routinely do. These are all also options. And you can decide if you want this or if you don't want this. And because like with the way that like consent works, it's from what I've seen is like you sign a consent form to receive care at that facility if you're going to a hospital, and then there's not a whole lot of asking for consent like for things
Step
as they
by
come
step
up.
as it goes, yeah.
Right. Yeah. So it's a lot of like, well, now's a good time for me to check your cervix and things like that, rather than like, is it okay if I check your cervix right now? So just like I'll tell my clients, if you want a nurse to be more explicit and ask you if it's a good time, then you can, have that dialogue with the nurse and tell them that that's what you want. But I'm not going to step in and be like, you should be asking my client, not telling them, because it's also really important for me to have good relationships with the medical staff and for them to respect me.
Yeah.
Yeah.
Yeah, well, that kind of advocacy seems incredibly important to me. As somebody who's been doing this and just kind of seeing the way our society, or at least the portion of it around you, is dealing with births, what concerns do you have? I mean, you mentioned that our country has a pretty woeful track record in terms of infant mortality and these other outcomes.
Yeah. Something that's really important to talk about is that not only does the U.S. have like the worst maternal fetal outcomes, but those numbers are even worse if you're Black or if you're a person of color. And that's not okay, and there's studies that show that if you are African and you're in this country giving birth for the first time, like you're a first generation in your family in this country, then your outcomes aren't necessarily worse. But as soon as you've been here for more than a generation, then you start having worse birth outcomes in this country.
Huh.
And so there's a lot of different ways to interpret that. I personally think it has to do with just carrying around the stress every day and having these higher stress levels from like trauma that's been passed down from the generation before you. And and having probably maybe not as much trust in your medical team because of, stories that you've heard in your lineage and that sort of thing. And so it's really a privilege to be able to walk into a hospital setting and say that you trust your care providers.
Yeah.
And that's just the reality of the situation. I wish that it wasn't that way. I wish every single person, whether it's a trans man of color or a wealthy white woman, like everyone should be able to trust their care providers and trust that they have their best interest in mind and aren't making any judgments about them. And so that's also like, if I'm picking up on anything like that, then I can, that's a hard line to play. Like sometimes I pick up on things that my clients don't pick up on things. And my job is not to create a negative experience if they're not having a negative experience, So that's one thing that we're really trying to do in our program is find out ways to hold the care providers accountable for things, especially in the hospital setting. Like, I don't know, I feel like the hospital doula has a bad rep because people think like doulas should be in the home births and doulas should be where people don't have the support of the hospital team, and the hospitals are, these racist institutions and they're big business, and doulas shouldn't be supporting that. But I feel like my role in the program's role, we're always thinking, especially like I can really speak to this because I'm in the office as well. And we're always trying to figure out like, how can we hold these people accountable? Like, how can we make sure that this never happens again, or that never happens again? And sometimes it feels like an uphill battle. It's a big business and a big corporation.
Yeah.
And there's 3 of us working in the office.
Yeah.
So.
What advice would you have for expecting parents in terms of how to advocate for themselves? How to navigate these things and not fall into some of these pitfalls?
Yeah, hire a doula. And,
sure. To start off with, how do you even do that?
Yeah. Oh, yeah, we can start there. So there is a website called doulamatch.net, and you can go on doulamatch.net and put in your zip code and see a bunch of different profiles for doulas in your area. You can see what their rates are and just start emailing them and scheduling interviews. If you're not, or like, if usually doctors and nurses and midwives can also recommend doulas that they've worked with before. Doulas often have business cards sitting out at like birth centers. Even if you're having a hospital birth, I would say go into a birth center and see if you can find a business card for a doula. So a lot of it is kind of like word of mouth, or just using Doula Match. And then, doulas can really guide you on navigating this whatever system you're going to be entering to give birth. So also there's a lot of books that you can read and that talk about things that are normal and things that are not normal. Penny Semken is kind of, I think of her as like the grandmother of birth support. She was a doula before it was even called a doula. She actually didn't want the word to be doula because it's a Greek word that means servant. And Penny was like, no, I don't want all of these women to go around like with people thinking of them as servants. She was like, they're birth support people. And everyone was like, Penny, that doesn't really roll off the tongue. Like, we're going to call them doulas. So she's local to Seattle. She's still teaching childbirth education. And I've been her assistant in some of those classes. So I get to have this like dialogue with Penny Semken about how it all started. And she's written a lot of books. So like any book by Penny Semken, The Birth Partner is a really good book. Pregnancy, Childbirth, and the Newborn is a very thorough book that really tells you a lot of, and it does go into a lot of like hospital advocacy type stuff. So just kind of knowing that things are options, knowing that you're the boss because you're paying them, right? And and I also tell people like, yes, this doctor or this midwife could be an expert in their field, but you are the person that is an expert on your own body. you know,
Sure.
and at the very least, use that information and that knowledge just to engage in dialogue with anyone that's taking care of you when you're in labor, whether it's a doula and you just want to make sure you have the right emotional support, or it's a doctor and you want to make sure that you are playing an active role in your process.
Mm-hmm. Well, and then what about for the rest of our audience in terms of advocacy and doing something to change these negative birth outcomes?
Yeah. Become a doula. And we need more doulas. It's really interesting because it's like a very small percentage of the people that actually want a doula are actually hiring doulas. So there's plenty of room for more doulas, all kinds of doulas, abortion doulas, death doulas, birth doulas, postpartum doulas. We need more of all of them. And there are organizations like in Austin, there's ATX doulas. Here, there's several organizations that are specifically for providing services at no cost or low cost services to people of low income in situations. And so, like, there's a lot of organizations out like that that you could donate to, or might be able to volunteer with in some way or another. There are volunteer doula programs in Washington. I don't know about outside of Washington so much. So,
Sure.
Like if it's I think if anyone is interested in it, they should take the step and go to a doula training, and then you never know. There's so much room for growth in this field. Like anyone could become a doula and really and be really good at like the business side of it and start a doula program. Like this doula program that I'm in was my boss's like thesis project, while she was in grad school or something. So there's so much room for growth and for opportunity in this field. And I would just encourage anyone to commit to starting something like that if they were interested. We need more doulas. We need more advocates like in the rooms, in the labor rooms. I swear that nurses are on their best behavior when there's a doula in the room.
Fair.
Yeah, I mean, just in general, it feels like childbirth is something that we really don't understand as a society. I mean, you mentioned some of these different misconceptions, but as common as this is, I mean, this is something that almost every human experiences on some level, or certainly every human on some level is having an interaction with. And yet we still have, politicians talking about reimplanting ectopic pregnancies and, all of these just ridiculous misconceptions about how our bodies work, about how the birth process operates. So it feels important that this is a growing field.
Yeah, there's so much to learn. I almost don't even remember like life before doula training before I knew all of these things. It's hard to think about how much I didn't know about childbirth. And so then it gets really scary for a lot of people. And I think of contractions as being like literally like every ounce of strength that your body can manifest is going into this very intense feeling like in your abdomen. And it's all of your body's strength all at once, like manifesting itself. And
in a way that it maybe never really has, it's not
absolutely,
like pushing a barbell or something where like you've been training for this and like how to use those muscles.
No, it's in a way that it never has before for sure. And so I think a good chunk of it is like for our minds to be able to get through something like labor, we have to kind of surrender to it and, let it happen and not let our minds get in the way of it. And I think that's where medication can come in a lot of the time is when someone doesn't want to surrender to that. And using medication to, block those nerves so that they're not feeling their contractions anymore, they can stay more present. And that's just what some people need. It's like, I don't know what kind of history my clients have. I don't know what kind of sexual trauma they may or may not have had. And if their way to get through a birth is to, use that medication so that they can stay present and not feel out of control, and like that's going to be really empowering for them, then I support that. My job is to support that.
Absolutely.
But for anybody that feels like they can kind of cross that line and really surrender to the experience, then obviously I'm there for that too.
Sure.
And either way, it's like I just want them to feel like they accomplished something. I don't want my clients to feel like they were like defeated or like they didn't play any kind of a role in what happened.
Mm-hmm.
So yes. And I mean, and there's just like no way to know everything, to know what could possibly happen. There are some common scenarios that play out, and I talk to my clients about those, but you don't know what it's going to bring up for you personally. Like there's no way to know what your emotional experience is going to be like, even if you logically understand like the phases of labor and how it progresses and, all of that.
Yeah, and never mind the fact that you're introducing, perhaps for the first time, like a new member into your family and taking on this responsibility of creating life and, all of the poetry and the anxiety and everything that can go along with that. But you're in this incredibly scary medical experience in a room full of strangers staring intently at your vulva as you try not to, I guess, poop and tear and, your body's doing all of these crazy things. So I guess it's good to have somebody in your corner.
That's funny that you say that, Christy, because pooping and tearing are like the two things that people are the most worried about doing. I'm like, no, if you poop, it's actually like we get really excited about that because it means that you're using the right muscles and you're pushing in the right spot. So
I feel like
people will like
would
poop
definitely be more concerning to me.
I feel like I'm going to use that excuse next time I poop when I shouldn't, though. So
I'm using the right muscles, guys.
This is my doula told me this is perfectly natural. Okay, well, this is a fun episode.
Yeah, the whole tearing thing is really interesting because like episiotomies used to be very routine, and that's where they would like use scissors to cut into the perineum and open up that opening more, right? And they just used to routinely do that all the time. And then you would have to stitch up like it's like at least a 3rd degree tear with an episiotomy. I've seen people push out 9.5-pound babies and walk away with like a 1st or 2nd degree tear and no episiotomy. And so like one thing I've been challenged by recently is I'm having a lot of clients that are telling me that their doctors are saying that they're having a big baby. And then they're like, well, we can induce you before your due date. And then, your baby won't be so big that you can't push it out. And that's just the medical school of thought. I'm not saying that they're wrong or that they're right, but like that's what they're trained to do. I hear, oh, you're having a big baby. Well, you can do it. You can still do it, and like that's my approach. And I really believe as well that if nothing is working against you, like if you don't have an infection or some illness that's like weakening the power of your contractions, or if you don't have something in your anatomy and like your pelvis structure getting in the way, then you can absolutely birth the baby that is grown inside of your body,
Yeah, just
so
again,
I do a
provide
lot.
an opportunity for patients to advocate for themselves and the type of experience they want, avoiding unnecessary procedures when possible.
Right. Yeah, and also ultrasounds, like usually they're finding these measurements from ultrasounds and they can be like 10% off. So every time that a client of mine has been induced before the due date because of a big baby, they give birth and that baby is like so average, like 7.5 pounds, like picture perfect average baby. And then my clients that don't know that they're having these big babies, or they're just not as concerned about it, and then they give birth and it turns out it's like 9 pounds or more, and they're just, they're amazed. And so that's really interesting. And so I tell people like those ultrasound measurements are usually off, and just so they have that information when they're making that decision about whether or not to be induced before their due date. Because like one thing that we know now that we didn't used to know is that labor doesn't just start with the uterus contracting. The uterus doesn't just randomly feel like contracting one day and then that starts labor. What starts labor is the the fetus sending a message to the uterus, telling it, hey, I'm ready to be born. I feel nourished. I feel ready for labor. So it's time for you to start contracting. So
That's an
we know that
interesting
when,
idea.
So we know that when labor starts on its own, just spontaneously, it's because the baby is the one that started it. And there's so many things that happen in late pregnancy. We think of pregnancy as 9 months, and usually it's more like 10. And there's so many things happening in those last weeks that are really, really important. And also, they kind of just guess on your due date unless you just happen to know like the exact day of conception. It can be like off within 2 weeks. And so like if they're saying you're 38 weeks, so you're full term and your baby's big, so we can go ahead and just induce you and save you the trouble of birthing a big baby. What if you're actually 36 weeks and you're not even full term yet, And like, so I have those conversations with clients.
Okay.
Excellent. Well, it sounds like incredibly important work, and I really appreciate you taking the time to talk with us about it this morning. Was there anything else that you feel like people need to know, or that you just really want to draw as many eyeballs to as you can?
Yeah, I mean, I think people, anytime you have an opportunity to spread the message that birth is a normal thing and that it doesn't have to be associated with fear and with trauma or even with pain, because by the way, some people have orgasms during birth and that's totally normal too. That anytime you can spread that message, do it. We need to live in a world where the way that we came into the world isn't so scary and something that we can talk to each other about. So just talk about birth. My friends are probably all really sick of hearing all these birth stories. I'm like, there's more to come. Sorry. It's normal. It's normal and we can do it.
Normalizing things and talking about them is
normal and we can do it
by itself.
Well, great to hear. Thank you again so much for joining us. Thank you to everybody out in the audience for watching the episode. We, of course, hope that you'll continue to join us in the Discord chat after this is over, and look forward to seeing you next week. So now, I suppose in one of the more seamless transitions of this show, I'm going to take this conversation and add the phrase, go out and give yourself a big ol' orgasm. Or better yet, give somebody else one.
What are we doing, man? What are we doing?
No, you're done.